like you're like the case?
I'm the case today. I'm just really itchy and I can't stop scratching and it hurts to pee.
Porter, it's going to be a great night tonight, right?
Always is.
Everybody in the vet industry will know that you never say it's slow, or because then it gets crazy, and so you use laundry's caught up as the alternative.
And then I just say slow because it makes everyone angry and then it gets really busy and I love it.
I do the same things. I don't really believe that.
I don't either. It's slow, bring it on.
I'm Courtney. I just did an after dark evening shift. I mostly had vaccine appointments, quite a few allergy workups, which is pretty typical here in general practice. Lots of ear infections, some anxiety that I've worked on, especially puppy anxiety seems to be a big thing now with all of the COVID things.
So I think we're kind of restarting our puppy series here today, is that correct?
Yes.
Yes, awesome. And how's everything been going at home?
Super wonderful.
Super wonderful, I'd love to hear that. And house training's been going well and all that good stuff?
Yeah.
I'm just trying to figure out if I should recommend you socialize her or not yet. So unfortunately with puppies we have this really narrow socialization window actually, yeah, of them learning how to interact with other dogs essentially, and often they can be a little bit shy like this and things like that. So if you know anybody who has like a litter mate that's vaccinated, or like if you have like a family member that you know the dog's vaccinated, you really trust them, no trauma here. Oh, I know. It's a kitten needle, so they usually don't notice them.
I've also brought in one of my long-term patients. He's had a corneal ulcer for way too long now, and I've been doing some reading. So I just recommended he come in and get a procedure called a grid keratotomy.
So what I'm gonna do is put the numbing drops into his eye. Wait, I can see it coming off. That's so cool.
It's okay that he's blinking.
Yeah.
Did you get it?
Boy, I did.
That was it?
That was it.
You did it!
I kind of want to stain it so I can see the area. So I'm just gonna put some stain on the eye.
I think there's stain on the window.
What?
Oh my god, ouch.
Is this the worst UTI you've ever seen?
Oh, it's like bacteria and like white blood cells or red blood cells or like rods that are just like swimming like.
No wonder I'm so damn uncomfortable. Okay, kiddo, let's stain this eyeball.
Can you sit?
Okay, now we're just gonna flush it out, buddy. So there's a little bit of uptake there. So I'm just gonna put it on the blue one. And you can see there's all this uptake right here in the center. And then there's like this blue haloing around the outside, and that's where the dead epithelium of the cornea has lifted off the rest of the eyeball. So I'm just gonna flush out the stain. I'm just numbing it one more time because I'm paranoid that it's ouchy. So I'm gonna take like the smallest needle we have in clinic and gently, ever so carefully, scratch his eyeball with it on purpose in a grid fashion. Oh, that comes off really nicely actually. I don't know if you can see that.
I can.
Oh, that went amazing, kiddo.
Good boy.
So now we're gonna take a little bit of blood from him and spin it down, and we're gonna put some of his own serum into his eyeball to hope it heals. And then I'll also send him home on a couple specific antibiotics, the serum, and a pain control topically.
So I'm just collecting blood, and ideally, because I have to get like a large amount of blood, because we need a lot of serum, we need a lot of blood, because we'll have to spin it down, and when you spin blood down, it separates it, and so the serum to blood ratio, you need a lot of blood volume. So now we're gonna put them in a bunch of serum separator tubes, and then we'll let it sit for a few minutes, and then we'll spin them, and then we'll take the serum out and put it into a dropper, like a medication dropper, that he can put the serum into Mayweather's eye.
Dude, you're right, that is a nasty pee. Right?
Did you look at it?
Well, she said she had a UTI, and I was like, just run it here. And she's like, what do you mean run it here? I was like, what? Just run your pee here. So we did. And it's ouchy. If there's rods, you can kind of see them like all like swimming through here, and then they're like, it's really microscopic, but there is also cockeye, which is another form of bacteria. Yes, but yeah, she's got red bloods, white bloods, rods, cockeye, and I stopped investigating after that because I was like, she needs to go to the doctor.
Oh, damn.
Yeah.
No wonder it hurts so much.
Yeah, like you gotta
stop neglecting myself.
You got a raging UTI, girl.
If an owner came in with this pee of their dog and they were saying that it was peeing blood for 2 weeks, I'd be like, how dare you let this animal suffer like this? This is so painful. This is awful. You knew about this for 2 weeks, but and myself, I don't care.
Yeah. Porter, like, ouch. Ouch.
I know.
Like, how have you been sleeping? Like, I feel like I would have to pee like 24/7 all the
I
time.
don't pee because it hurts to pee, so I hold it as long as I can. Okay, so how long have you been noticing these like skin issues and things like that?
His paw pads have been dry like forever, and I bring it up like every time we've gone to a few different vets over the years, and I bring it up every year, but just to trying to get an answer kind of thing.
And I'm not super concerned because we want them to be calloused because they're walking on them, right? So if they're really nice and soft and dry, that's just gonna hurt more because they're hitting rocks. That being said, if you are worried with how dry they are, you put on something like the Mushroom Secret and stuff.
Yes, and he doesn't like when you touch his paws, he kind of pulls them away, so.
Yeah. So what I work on with my dogs, and my dog's the same way, I will hold this paw for as long as I can. And when you start to do this, oh, good job. And then you just try to extend that amount of time. This is an incredible looking dog. Aren't you? Yes, you're a very good looking dog. You know it too, don't you? So for his bad belly, we could definitely do a diet change and see if that helps. We can kind of put him on like the Purina chicken or something like that. We could also kind of do a diet trial for allergies, but honestly, he's pretty well managed there. So let's try the easy route first. And then if you're still finding he's eating grass and vomiting and you can still hear stomach, bring him back and we'll do like a diet trial for like a food allergy. Okay. And then today we're due for Bordetella, I think, and that's it. So I will go grab that. Oh, that guy's a Newfie.
Oh, he is?
Yeah. And his dog's name is Mr. Puck. The Newfies just like to go out on the ice and play hockey and just shoot around the park. And yeah, it's just Newfie. It just sounds like something I hear at home. I know hockey's everywhere, but it's a Newfie thing, okay?
Luna, thanks for coming in. Thanks for coming in. Watching the one that comes with the tail in and watching the tail slowly come out while we're here. And it's like, oh, that's like winning, right? Totally winning.
Coco, we are here for some vaccines. Okay. And how's everything been going at home? Good. Good? Hubby, training going outside is going well?
I have no comparison, so I don't know what well means.
Oh, okay.
Two different days she vomited back up her meal.
And does she vomit right after she eats? Like she scarfs it in kind of thing? Or
She always scarfs it in, and then the times that she's vomited were not immediately after, but probably within a half hour.
Okay. Do you guys have any slow feeders or anything like that at home?
No.
I can definitely show you. There's so many good slow feeders on here, and there's also something called snuffle mats that are really great for puppies.
So that's good to get the brain going.
It does, mental stimulation. And then she's due for her second one, so we'll do her Bordetella and her another parvo shot, and then on the next one in 4 weeks, we'll do her last parvo combo one, and then the rabies.
Okay.
And then we'll send you home with some dewormers today too, honey. Oh yes, oh yes.
Thank you so very much.
No problem. Lincoln, you look very nervous about me.
Yes.
So this is your second round of vaccines.
Yes.
Whoa, the looks he's giving me, it's breaking my heart. You're breaking my heart, kid.
Can we take him for walks?
I would highly encourage it.
Yeah.
This kid.
Okay.
Yeah.
Because we've just been sticking in the backyard.
I think he needs some exposure, and like you're not wrong for doing that. So I managed to make up a game plan, and we have 2 of the medications I would like him to have.
Okay.
We had to order in the other 2. It's a pretty intensive treatment program. This one is it's actually an antibiotic that we kind of specially made for his eyes.
Okay.
So it might look a little bit funny, like the packaging and stuff, because it's a different packaging, and we reconstituted it a little differently. This is actually really cool, because I'm a nerd, that we took some of his blood and spun it down and took the serum from his blood, and we're actually going to treat that ulcer with the serum from his blood.
Okay.
And it has shown to heal ulcers in like 3 days. I would love to see him back here in a week just to see how my procedure went. We love him. We love him so much. And just you being so diligent and coming in and like really wanting to fix this for him means the world to us.
Well, I don't want him to lose his eye.
Exactly,
Yeah.
right?
I don't know who saved who, but you know,
I feel the same way
neither
about
one of us did, so it's good.
Exactly. We'll get your eye all better. Your dad's gonna do a great job with your drops. And the owner was really, really great and thankful, and it just overall gave us a great feeling about the night.